And welcome back to this special edition of the Fox 19 News Morning Extra. It is the 19th of the month. It's why we are wearing pink. We are thinking pink across the area as we raise awareness for breast cancer. Today, we are thrilled to share that we are joining partnership with St. E. It was about 15 years ago that they introduced this new concept to the area called Nurse Navigators. From the moment of a diagnosis for breast cancer, a team of nurses would join this breast cancer patient and help them through the process. I am thrilled to introduce you to Terry Bogan. She leads the Nurse Navigators here at St. E. Terry, good morning to you.
Good morning.
Talk a little bit about this program and the new concept that was introduced about 15 years ago.
Well, it really started when patients transitioned from being inpatients for breast cancer to outpatients for breast cancer. And what focus groups told us was they felt like the care they received was good, but they really needed a point person to help educate them and to navigate them through all of the options that breast cancer presented to them. And so the Nurse Navigator program was born from that need.
Well, I would think as a woman and a diagnosis of whether it be breast cancer or anything else, there are a lot of questions to be had, and you almost need that sense of that medical expert to kind of put things into perspective and help you. So is this Nurse Navigator, is she a registered nurse? Who is she exactly? And then what does she do from the beginning?
Nurse Navigators at St. Elizabeth are definitely registered nurses, and our point of contact begins at the time of an abnormal mammogram. If a radiologist indicates that a patient needs to come back for diagnostic imaging, a Nurse Navigator will place that call and explain to them the routine process of obtaining diagnostic imaging. If after the diagnostic imaging, a biopsy is recommended, then they'll also meet with the Nurse Navigator at that point to explain what the biopsy will entail and how they will obtain the results, and primarily to provide emotional support during that time. We know that having a biopsy for breast cancer is one of the most stressful periods that a woman can go through, and so we have found it to be extremely beneficial for our patients to have a Nurse Navigator explain that to them and to be there and available for them during that time. So it starts very early in the process.
So it's a team within your hospital that meets with these ladies. But here's the great thing. In the late 90s, Madonna sharing with the units, the mammography units, going out into the community for those women maybe that don't have access getting to the hospital to get their mammogram. So close to what you do in the hospital, what, about 50,000 mammograms a year?
Yes, that's correct.
And then close to 7,000 here in the van. So how do you think this has helped, this message taking St. E out into the community?
Oh, it's been wonderful. We go to rural areas routinely and screen women who would not probably get mammograms otherwise. In addition to that, St. Elizabeth and Madonna specifically have been very proactive in obtaining funding for women who don't have insurance to get their screening mammograms. And so we have done, I feel St. Elizabeth has done a great job of really enveloping those women into their care to try and meet their needs, whether they have insurance or not. And so it's been fabulous.
Well, today and every day, but especially on the 19th of every month, we like to bring awareness, the importance of early detection and mammograms. I know, you hear different things back and forth, you need to be 40 to have your first mammogram, but what are the guidelines now for women? Because unfortunately, we're hearing younger and younger and younger women being diagnosed with breast cancer.
That's correct. And what we find is that we diagnose women aged 40 and beyond through mammograms every day. And we know getting your screening mammograms can save your life, because the earlier we detect a breast cancer, the better your odds of surviving that breast cancer. And so early detection has been key in helping the survival rate for women who have been diagnosed with breast cancer. So our experts still recommend annual mammography beginning at age 40 and obtaining a clinical breast exam from your doctor every year as well. Early detection is still key.
Well, and we hear oftentimes in stories is that you have to know your body and you have to have open communication with your doctors as well. Terry, thank you very much. Coming up, we're going to show you how easy it is to meet up with the St. E mammography van to get your mammogram. We're going to meet with Jody. She is a tech here. She runs one of the vans called Daisy. I think that's adorable. We're going to take you through and show you how easy the process is. That's coming up next on the X. We'll be right back.